Okay, this is a big deal. I've been trying to get this word out now for about 12 years. It's about the buccal fat pad within the face and utilizing the sculpting of it to sculpt and contour the face. So the buccal fat pad creates a contour in the lower third of the face. The classic argument would be, oh, that's going to prematurely age you. The key is, look, we got to look at some anatomy. Okay, so look, here we got the face with some anatomy. You're going to see the superficial fat pads. Those are what lead to aging. The superficial fat pads shrink with age. Watch them shrink here. That leads to the classic compartmentalization of the face, starting to get separation of these two superficial fat pads. To correct this, we take a needle or a canal, we go externally through the face, and we fill fat or fillers to smooth out those compartments. The buccal fat pad, you have to take away those superficial fat pads. You see the arteries, the muscles, the nerves, the parotid gland, the facial artery, the facial vein, the facial nerve, the parotid duct. All of these things are superficial to the buccal fat pad. Then the buccal fat pad is deep. It's deep to these. It actually becomes engorged. It pseudo herniates with age. So it actually increases with age. Now I'm going to come to a few articles. Look at this. These gentlemen, brilliant gentlemen, have proved that over time the buccal fat pad gets bigger. It engorges itself. It's like the orbital fat. It's a different fat pad. Any surgeon out there watching this who has seen orbital fat and who has seen buccal fat knows what I'm saying. It's yellow. It's bright. It has a high stem cell content. It really is very hydrophilic. It absorbs water. It has a sustainability to it. So over time it gets bigger. It's like the orbital fat. We manipulate that fat pad because as people age, it pseudo herniates through the orbital septum. Similarly, the buccal fat pad pseudo herniates through its capsule. Another article showing, boom, this fat pad does not shrink with age. People who say that are wrong. I'll repeat that. People who say that are wrong. So you're either ignorant or stupid if you say that. I don't know what else to tell you guys. It's just the reality of it. Research it. Look at it. Now, all of that being said, the buccal fat pad, removing it or shrinking it, does create a contour of that lower third of the face. So that needs to be an aesthetic you like. If you don't like the contour of the lower third of the face, if you don't like a little hollowness here and a sharp jawline, then it's not the right procedure for you. There's some populations, the Korean population particularly, they like a round face. A round face is what their aesthetic is. So it's an aesthetic. This is about consent. It's about patients knowing what they're getting. If it's something you like, a little bit of that contour, if you think that's sexy, if you think that's hot, I particularly do, then this could be the right procedure for you. So it's really about the layers in the face. Think about a layered cake. You have the top layer is the cream, the second layer would be kind of the first layer of cake. That would be the superficial fat pad. You don't want to mess with that or the top layer will get wavy. The buccal fat's like the ice cream at the bottom. It really gives the firmness. So manipulating that, if that melts, the top layer of the cake gets a little contour. But it doesn't get wrinkly and old looking. That's the superficial layer. That's the superficial fat. So the buccal fat pad does not shrink with age. It does not prematurely age you. I'll argue it with anybody. I think anybody who says it does has never cut through the layers of the face. So we have a cadaver head here every year, and we teach the fellow and some of the injectors in the office the layers of the face and how you manipulating them manipulates and sculpts the face. So the key is the layer that we are manipulating. I've added to this, I've expanded this procedure, removing the mucosa and manipulating the muscle on the internal portion of the cheeks, the buccinator muscle. So if you bite on your cheeks and look at your 3/4, you'll see that actually lifts the jowl. It's like an inside-out cheek lift, I call it. So that actually decreases aging. I mean, it's so powerful. It's a really neat proponent of this procedure. I extrapolated that twofold. One, when we do a lower eyelid blepharoplasty, we take a little strip of that muscle, the orbicularis, which is a sphincter, the buccinator muscle, also a sphincter. So I take a strip of that, and that further tightens the cheek, further sculpts that area, and lifts up the pre-jowl. I had a patient at the county who had a skin cancer here. We cut it out, sutured it closed, and then she came back and said, "Wow, my jawline looks spectacular. Can you do it to the other side?" I said, "No, you're not gonna have a scar, you're not gonna risk those nerves." But I said, we can take the mucosa muscle. I do it on these buccal fat cases, so we take the mucosa muscle on the inside of the cheek, and that really lifts things. Not to the same degree as the skin, but it can be a powerful maneuver. Check it out. Buccal fat pad sculpting to decrease aging and to further sculpt the face. Bingo, baby.